All right, what is up, guys? Today we are going to be talking about Little League shoulder. If you're a youth athlete, or if you've been playing travel ball or even into high school ball, you've probably you may have had this yourself, or probably you've known somebody that's had Little League shoulder. And so, really, we're just going to go through like what this actually is and just a very high level overview. We're not going into too specifics, but want to give just a quick overview of like what this is and how it kind of develops, and what it causes, and like really what do you do about it, right? So let's dive into really what is Little League shoulder, right? So it is an overuse injury in specifically youth baseball players, right? We don't see this in honestly any other sports just because of the mechanisms of overhead throwing. So typically this is going to be for kids ages, anywhere from 11 to 16. I've actually seen it a little bit older, highly depends on the athlete. And it's just because there is irritation of the growth plate. Okay. And so with overhead throwing, we're always cocking back into this externally rotated position, and it puts a ton of torsion on the shoulder joint itself. And so with younger athletes, the growth plates are still open, and the torsional stress that is imparted through the shoulder joint just because of throwing is it always attacks essentially like the weakest link, if you will. And so the growth plate, since it's not fully solidified as bone yet, it really can put increased stress there and just cause irritation to that area. So it's really a stress reaction to the bone, and that's kind of like what we would look at it as. Like I alluded to, it's really just because of repetitive throwing motions. Typically, athletes we're playing year round nowadays, which it shouldn't be that way, but athletes are playing year round. They're throwing more than ever. We're seeing athletes and really not looking at pitch counts. A lot of people are going off of more like innings pitched, and it really should be on pitch counts because that's the amount of stress that you're actually putting on your arm. Okay, and so it goes beyond just actually pitch counts in games. You have to consider the amount of warming up throwing, and you have to consider how many pitches you throw just to get warm before you actually step on the mound in a game, right? And then you have to consider all of the pitches you're throwing in the game actually to batters, and then on top of that, when you're getting warmed up for an inning, you're typically going to throw a few pitches to kind of get warmed up and ramp back up for the inning. So you have to think about all of the kind of just throwing and stress that you're putting on your arm, throughout the course of the year. And so, like I said, this is just a high level overview. There's so much more to this, but we're just going to hit the brief, the topics that we need to talk about today. All right. So when it comes to symptoms to look out for, really, with this kind of stuff, you're going to see it more on kind of the outside of the shoulder. You can feel on the front, more the outside. It's more going to be a generalized location, right? So it's not going to be like I have pain directly here on this tendon, or on this muscle. It's going to be a little bit more diffuse just on the outside of the shoulder. Typically what we'll see is, athletes start to complain of, they don't feel like they have as much control with their pitches, or you're going to see a drop in velocity, right? So these are going to be almost like the warning signs of your body telling you like, hey, like I'm having a lot of stress going on here. We might want to look out for this, right? Or just an overall decrease in throwing performance. So they may not be necessarily a pitcher. We see this a lot of times primarily with pitchers, but say they're playing shortstop or third, and they're having a hard time, throwing across the infield, right? They can't throw it as far as they could before because something's going on. Of course, you're going to see the soreness after pitching or just playing long games. And really, it's kind of more like a gradual onset. So, we'll typically see this kind of develop throughout the course of the season, or if an athlete just ramps up too quickly, say they don't do anything over the off season, they took, you know, time off and they didn't do any kind of throwing or something like that. And then, all of a sudden in February, we're going from 0 to 100, right? And we're just going out and throwing as much as possible. We're doing more bullpens and pitching lessons. And, there's just a huge spike in workload essentially. Then we're typically going to expect to be some sort of increased stress on those structures as well. And sometimes you might actually have athletes say that they feel like really just not as strong, or they just feel like they're lacking mobility as well, right? All right. So what causes it? Some very specific things. So like I said, this is an overuse injury specifically for youth baseball players. And, it's really just because people are playing year round, right? We're not taking time off like we should, and people aren't playing other sports as well. And so we're focusing so much attention to overhead throwing that they're just not getting the rest that they need. Okay. A huge thing that is a risk factor for just, I would just say, arm injuries in general is actually pitching and catching in the same game. So that's a huge no-no, right? Like if you catch, 3 innings and then you go into pitch that game, like that's a ton of throwing that you've already done because you've got to catch the ball, throw it back to the pitcher, and now you're doing the opposite. You're throwing it to the catcher now, and so that's a ton of throwing. A huge thing, like I alluded to earlier, is just not following pitch counts. A lot of people go off of innings pitched instead of pitch counts. I honestly have no idea why it's actually innings pitched, because you could have, an inning where you throw 25, 30 pitches, and, the next inning you throw another 20 pitches, and then you're upwards of 40, 50 pitches in only 2 innings, right? But based on the innings you've pitched, you can actually come back and pitch the next day and the next day, right? And so you're not accounting for how much actual throwing you're actually doing if you're looking at innings pitched. And so we always have to look at pitch count specifically. And honestly, too, a huge thing is throwing mechanics, right? So I've seen some wonky throwing mechanics with youth athletes, and it's really just because they haven't been taught the right ways to throw. They're not thinking about how to activate certain muscles when we're throwing, getting into certain positions at certain times. And so we see a lot of just poor throwing mechanics that can increase stress on the shoulder itself. Okay. All right. So what do you actually do about it, right? So the key thing for Little League shoulder, and I sometimes hate to be the bearer of bad news with this, but if somebody has Little League shoulder and, they go to an orthopedic physician to get evaluated, or a baseball physical therapist, and I suspect that it might be a Little League shoulder, I'm probably going to send them for some sort of x-rays, because we need to see if the growth plate is impacted in some way. And so typically we can see that on x-rays. And like I said, I don't want to be the bearer of bad news, but typically, you have to rest the arm. Like, since it's a bony stress reaction, we have to allow the bone to actually heal and to reduce the stress to that. And the only way to do that is to not throw. And so the recommendation is really to not throw for about 12 weeks. And that's just the amount of time it takes to allow the bones just to calm down and get back to, where it's in a better place. And so I hate to, be the bad person sometimes, but, as a healthcare provider, I would be being negligent if I, told somebody just it would be fine to throw, right? And so we have to be always mindful of, how much stress we're allowing these kids to put on their bodies and stuff. And so, it goes beyond just getting evaluated, right? So, you have to do physical therapy, right? You have to gain back your strength and your mobility, and go through a really, a very proper progression of programming in order to get your body to a place where you're really strong. And so, then it goes beyond that. So, like, we have to get back to where we're strong, we're out of pain, and we're, back to normal daily life stuff. But, at the same time, like, you can't just go, once you get out of pain, you've hit the 12-week mark of no throwing, you can't just go straight back into throwing. You have to do a proper return to throwing program. And this is where I see probably like 90% of people get things wrong, honestly. So they may go to just a generalist physical therapist that probably has never played baseball before, or really just knows anything about throwing biomechanics. And, they'll do an okay job of just getting them back stronger, improving their mobility, because that's what, we're taught to do in physical therapy school. It's just as our basics, we can treat everybody. But it goes beyond that. And so you have to be on a proper return to throwing program. And it's more than just a piece of paper. So a lot of, return to throwing programs nowadays are really based off of a program that was developed like 20 to 30 years ago. And it doesn't account for, you know, a very individualized approach, essentially. And so we see athletes try to do a throwing program based on some protocol, if you will, and they just don't do it right, because there's no accountability, there's no customization to it. They don't know how to progress and when to regress. And so that's why athletes need to customize a very structured throwing program that is just for them. And you have to have the accountability, and you've got to be able to, bounce ideas off of with a provider that really just knows what they're talking about. And so you have to have a custom program when it comes to getting back on the field. Okay. All right. And so I think the biggest question that I get a lot of times too, once we get to the later stages in physical therapy for this, is what do we do to stay healthy long term? Right. I mean, that's a very logical, question to ask, especially after, your son's had an injury that you've had to sit out for 12 weeks. You don't want this to happen again. And so we've got to do something to have proper management for the long term. So where we're thinking about the long term health and wellness of this athlete's arm, and honestly, so they don't become an injury statistic again. Okay. And so the biggest thing I would say from, a throwing perspective is, we have to have proper mechanics of throwing, right? So that should be something we have been working on within physical therapy and doing the right things when it comes to that regard. But you got to follow pitch counts, like I said earlier. And so there are some pitch guidelines, essentially, or pitch smart guidelines. And so I think this is a great place to start. It's not perfect, but it's a great place to start. And we're starting to see a lot more research coming out that's actually saying that, even though this stuff is out here, guys, we're still not, coaches and parents and stuff, they're still not following it because the pressures of the game, almost takes precedence over being smart about how much pitches you're actually throwing in a game. And so I would say this is a fantastic place to start. And so I would go Google the Pitch Smart guidelines. And look at your age and really look and see what those guidelines are. But like I said, at the end of the day, it's something you actually have to prioritize and you have to make sure that you're following these guidelines. And so it's a great place to start. But at the end of the day, you've got to just listen to your body and just honestly don't abuse your arm. So if you're getting sore, if you're getting kind of tweaked up here and there, you've got to be proactive and doing the right things to stay healthy. And so, you've got to be doing proper warm-ups and proper arm activation drills right before you're actually going to your bullpens or pitching lessons. We've got to be doing something to get these tissues prepped to take on the demands of what you're actually about to go do. And so arm care, of course, I would say, or honestly too, when I talk to people, arm care, the term arm care, it's a very watered down term nowadays. And it's usually just some very basic exercises that, these kids your athletes will find on TikTok or Instagram. And honestly, it's not the things that's really going to make their arm stronger. And so when I think of arm care, it's very detailed, it's very structured, it's very specific to the athlete. And I think really long term, that's what every athlete needs. Okay. And you've got to do a real strength and conditioning program, right? So, to improve your performance and, stay healthy long term, you've got to get bigger, faster, and stronger. So the stronger you are, the more resilient you are, and will ultimately reduce the risk of injuries. Um, so playing other sports is a great way to give your arm a break too. I love it when I have baseball players, they'll play in the spring, and then, when fall comes, they're transitioning to football, and then they're going to go play basketball. And then after, you've played all these sports, you've given your arm just naturally a break from throwing because you're focused on other sports. And two, it allows you to train different body regions and different movement patterns than just doing a very specific pattern over and over and over again, such as throwing. Okay. And I would say, honestly, to stay healthy long term, you have to work with somebody that really knows what they're talking about when it comes to working specifically with baseball players and understanding the unique needs of baseball players, and that can ultimately prescribe the right exercises for you. And that way, as parents and coaches, you can bounce ideas off of, a baseball physical therapist and just make sure that you guys are doing the right things to keep these players healthy as much as possible. Okay. And so I would say at the end of the day, it's not one specific thing that you're saying, like, if I check this box, I will 100% stay healthy. It's not like that. It's never like that, actually. And so there's always multiple different factors or variables that have to be just accounted for. And, it's a team approach, right? It requires the coaches, it requires the strength and conditioning staff, it requires physical therapists and the sports medicine staff to really give these athletes the proper care they need to ensure that they're developing properly. Because I think if we have all three of those domains, then the athletes are going to be taken care of. You're going to have improvements in performance, and just long term, these athletes are going to be able to stay as healthy as possible, and have long, successful, healthy careers. So I would say, those are the top things when it comes to staying healthy long term. So let's recap all this kind of stuff. Okay, I know this was a really quick just video, but honestly, Little League shoulder is an overuse injury, and it's one that's most likely, honestly, I think it's something that actually can be prevented in some ways if you're doing the right things. And so, with injuries and things like that, you can't prevent all injuries from happening, but overuse injuries are something that's very specific that we can take the proper steps to reduce the risk of it happening. And so, Little League shoulder is definitely one of those. We got to recognize the early symptoms and get evaluated ASAP. Do not wait. Do not push this off. Listen to your athletes. Listen to what they're saying and listen to their bodies because it's telling them something. Okay, you got to rest, you got to rehab, and you have to do a structured return to throwing program. That is absolutely crucial. And like I said, that's where I feel like 90% of people probably get things wrong and kind of just go from 0 to 100 and getting back to throwing, and it's never going to end up well, honestly. And so, like we just talked about, long-term athletes, you got to be doing your arm care, you've got to be doing your recovery work, you've got to be doing actual real strength and conditioning programs, which is different, by the way, than arm care, okay, and your recovery work, okay. Those are two different types of trainings as well. And of course, you got to improve your mechanics, okay. I think that's yeah, that's going to be an absolute key crucial thing for developing proper arm mechanics and just patterning and things like that. Athletes can definitely improve a lot developmentally if we're taking the right steps to improve throw mechanics and doing the right plyo ball drills and all that kind of stuff too. Okay, so hope this was helpful, guys. There's so much to unpack when it comes to Little League shoulder and different types of injuries, but at the end of the day, we've got to be doing what we can as a team to keep these players as healthy as possible. Okay, thank you guys for watching this. I will see you guys in the next video.